Microrobots learn to swim against blood flow. 12 million strokes occur every year worldwide. Doctors inject drugs to dissolve the clot, but the medication spreads throughout the body. They have to administer a high dose to make sure enough reaches the blockage, which leads to serious side effects, including internal bleeding. ETH Zurich has built a microrobot that delivers the drug precisely to the target. The robot is a spherical capsule made of dissolvable gel with iron oxide nanoparticles inside. Brain vessels are tiny. The capsule must squeeze through them while still remaining magnetic enough to control. Fabian Landers, the lead author of the study, says this is the main puzzle: how to pack sufficient magnetism into a microscopic capsule. Inside the capsule, there's a contrast agent based on tantalum so doctors can track its movement on X-ray, plus the actual drug, a thrombolytic, an antibiotic, or an anti-cancer agent. A high-frequency magnetic field heats up the nanoparticles, melts the gel, and releases the medication. Delivery happens in 2 steps. First, the microrobot is launched into the bloodstream or cerebrospinal fluid through a catheter equipped with a special gripper. When the catheter reaches the target area, the gripper opens and releases the capsule. Then electromagnetic navigation takes over. For testing, the team built silicone models of blood vessels that precisely replicate the anatomy of patients and animals. On the model, they successfully targeted and dissolved the clot. After many successful model runs, the team moved on to real conditions. In pigs, they demonstrated that all navigation methods work and that the microrobot remains visible throughout the procedure. They then tested microrobots in the cerebrospinal fluid of a sheep. Beyond thrombosis, microrobots could treat localized infections or tumors. From the very beginning, the team focused on ways to bring the technology into operating rooms as quickly as possible. The next step is clinical trials in humans.